So the JAK inhibitors and the biologics, such as dupilumab, have very different modes of action and therefore also have very distinct infection risk profiles. So the JAK inhibitors, they broadly inhibit the JAK-STAT signaling pathway and thereby they affect multiple cytokines, where biologics, such as dupilumab, tralokinumab, they more specifically block the IL-4 and IL-13, which are key drivers of atopic dermatitis. And due to this broader immune suppression with the JAK inhibitors, they also carry a higher risk of infection, while biologics, with their smaller, more specific mode of action, they may offer a more favorable safety profile regarding infections. I think it should definitely be considered antiviral prophylaxis, especially in patients with high-risk situations, such as a history of recurrent herpes simplex infections or, for instance, herpes keratitis. And in addition, there's also the herpes zoster vaccination available. And this should be, I feel, offered proactively and preferably to all patients starting the JAK inhibitors, but especially in older and immune-compromised patients, if it's, of course, not already included in the national vaccination program. Yeah, that's where I think shared decision-making comes in and is very important, because even though many of the infections with the JAK inhibitors are considered non-severe, like, for instance, the herpes simplex, they can still be very bothersome to patients, enough even to stop treatment, because that's what we found in our study. So the JAK inhibitors often work quite well and fast, which is, of course, good for our AD patients. But whether that outweighs the increased risk of infection, that really depends on the individual patients. So their shared decision-making is important, and also to look at the patient itself. Is there a history of infections maybe? And what's also comes into play there is the availability of any other treatments. For instance, if the patient hasn't had a biologic and is prone to infections, you might lean towards that. But in a patient who has already had every treatment, you might make a different choice. So this is really something to discuss with your patient.